Kenya recorded an all-time daily high of 796 coronavirus cases, crossing the 15,000 mark. The surge in numbers is causing worries as most infections are community-based. Citizen TV's Enoch Sikolia reports.
She walked to the press briefing stand at the Ministry of Health to show how COVID-19 was afflicting Kenyans.
Today, the news is not any better.
Picking out numbers, including those of the country's capital and neighboring counties, to draw a pattern that is worrying, especially those on the battlefront.
Today is the day that we have actually recorded the highest number of positive cases since this pandemic struck.
The ministry revealed that of the 6,754 samples subjected to laboratory tests in the last 24 hours, 796 had turned positive for COVID-19. This pushing the total number of confirmed cases in the country to 15,601.
Again, leading to the emphasis that we've placed that this disease is really well within our communities.
Well, the numbers are rising and the government is aware that much has to be done. But to stop the contagion from sinking deep into the population, it says each and every Kenyan must act responsibly.
Any one of us could actually be afflicted with this COVID-19 disease.
The distribution of cases shows the concentration of the virus in Nairobi and the neighboring counties of Kiambu, Machakos and Kajiado. Nairobi had 539 cases, Kiambu 63, Machakos 57 and Kajiado 37. The virus had not spared those on the front line either. There is a rise in infections among doctors, nurses and laboratory technologists, threatening the country's healthcare system.
The number have continued to recover, but what we have actively right now that we are following up on about 500 of them. They are in a number of facilities, some in ICUs, and a number just have mild symptoms.
There is a fear that rising numbers of infections among healthcare workers could make hospitals become nexus of infection. They could simply become breeding fields.
Over 70 facilities have now reported cases, at least one case each, in their facilities. So it is not affecting any specific facility, but any. And that is why we advised that each and every health facility, even small clinics in town and in the informal sectors, they need to prepare themselves and have PPE ready.
The impact of the pandemic has been hard-hitting and painful. The Ministry of Health says they have recorded increased cases of domestic violence during the pandemic period.
Unemployment, the inability to provide for families, the economic uncertainty that we are facing may have added extra strain and heightened anxieties amongst families. However, again, we do repeat that this is not an excuse to meet any form of violence.
According to the CIS, close to 5,000 rape cases treated in healthcare facilities were reported between the month of March and June. Most of the victims of rape were girls aged below 18 years. She says they represented 70% of the rape cases. 5% of the cases were of young boys. Enoch Sikolia, Citizen TV, Nairobi.